All right, so we're going to talk about Module 4. So afferent neurons let me start over. Afferent neurons transmit impulses towards the brain. Cerebral perfusion pressure is determined by the mean arterial pressure and intracranial pressure. Efferent neurons transmit impulses to muscle tissue. Let's see. You guys did really well on this exam. If a patient is hyperventilating, the paramedic would expect blood flow to the brain to transpire in which way? If we hyperventilate the patient, we would expect blood flow to the brain to decrease. Okay, let's see here. Question 15 says, which of the following is true of a stroke? Our answer choices are 85% of patients have the type of stroke that will benefit from fibrinolytic therapy, 15% of strokes that are the type that rarely lead to death in the first hour. Many stroke patients have many hereditary risk factors but few modifiable risk factors, or there's usually no warning that a patient will have a stroke. Well, sometimes patients do have warnings. They have TIAs, they take certain medications, they have a family history. There's all the things that kind of lead a person to think they could possibly potentially have a stroke. They live unhealthy lifestyles. Let's see. So our correct answer here is going to be 85% of patients that have the type of stroke that will benefit from fibrinolytic therapy, and that's going to be the ischemic stroke. Okay, your partner suddenly falls to the floor and becomes very rigid with the occasional relaxation of the muscles. His temperature is normal. He is apneic and incontinent of urine. What type of seizure is described? This is your tonic-clonic or grand mal seizure. Diazepam has which significant side effect? Respiratory depression. That's huge, okay? Okay, muscular dystrophy is an inherited disease that's slow, that causes slow progressive degeneration of muscle fibers and usually causes patients to die by the age of 12. Muscular dystrophy. You have a 55-year-old male with a history of seizures who is on the floor and experiencing tonic-clonic motor activity. His jaw is clenched. He has peripheral cyanosis and there are frothy secretions in his airway. Heart rate's 130. Respiratory rate is 4 and shallow. His SpO2 is 88%. So which is most appropriate? In this case, we want to make sure we suction the airway, insert an NPA, and then assist respirations with a bag valve mask. Okay, when referring to mental health care, biological disturbances are those mental disorders that result from a physical rather than purely psychological cause. Okay, when we talk about some psychological disorders, when we talk about that abrupt disorientation of time and place, that's known as delirium, okay? Delirium. Okay, let's see here. All right, that is the review for the Module 4 exam. If you have any questions, please feel free to contact me.